Welcome to Movement and Function. I'm Beth Wagner. Today's video is all about jaw pain. This is great for you if you've been experiencing pain, tightness, clicking in your jaw, or if you've been diagnosed with dysfunction in your TMJ, that's temporomandibular joint. This is the joint in the back of your jaw, just below your ear, behind your teeth and your cheeks. This video will cover 6 great exercises to decrease the pain and improve the mobility in your jaw, and I'll also show you a couple great self-massage techniques. Before we start with the exercises, I want to review a few symptoms with you to make sure that you're getting the appropriate medical care that you need. First of all, if you're having fever, tooth pain, or any issues with your mouth or your teeth lately, please go see your dentist right away. Secondly, if you're having any earaches, ringing in your ears, or decreased hearing recently, please see your primary care provider right away. Lastly, if you're experiencing severe headache, numbness, tingling, weakness, or dizziness, also please see your primary care provider right away. Those are all symptoms of something much more serious that need attention. Now, if you have a mild headache, some tension, some mild neck pain, the pain in your jaw might be referred from your neck. In that case, you might benefit from going through my neck pain video. I'll include a link in the description down below. In addition, it would be appropriate for you to continue with these exercises focused specifically on the TMJ, the jaw joint itself. Okay, so let's start in with the exercises. First of all, be sure that you're doing all of these exercises with upright posture. So quick posture correction. Be sure that you're sitting upright with your hips lifted, with the natural arch in your low back, so you're not slouched and you're not overarched. Relax your shoulder blades down and back, lift your chest a little bit, and bring your chin back just a little bit to make sure that you're not in forward head posture. Okay, so from that midline posture, the first exercise is a chin tuck. You'll bring your chin straight back as if giving yourself a double chin. Pause here and relax. Pull your chin back as you exhale, and then inhale as you come back to the starting position. The purpose of this exercise is to realign your neck to make sure that the back of your neck is nice and open and there's plenty of space in those tissues and joints to allow natural movement of your jaw. Do 10 chin tucks and then move on to the next exercise. Number 2 is rhythmic stabilization of your jaw. This exercise has 3 parts. The first part is to place your thumb underneath your chin and the knuckles of your index finger just above your chin like this. And then I'm going to press straight back this way, as if I'm pressing my chin toward my neck. Relax your jaw and let your mouth be open a little bit, maybe an inch or 2. So it looks like this. Start with a slow, steady pace of mobilization. You don't want to be pushing so hard that you're jamming your chin or jamming your jaw. You want it to feel like a nice, even movement. Part 2 is to move off to the side in line with the side of your jaw. You'll place your thumb underneath your chin around the side of your jaw and the knuckles of your index finger just on top of your chin. And now the direction of the push is in line with the left side of my jaw. And then open your mouth slightly, about an inch or so that it's relaxed. Let your tongue relax. Okay, part 3 is the same thing, but along the right side. So I'll place my thumb and my index finger just to the left of the center of my chin, and then I'll press in line with my right jawline, like this. If you feel some mild clicking in the disc in your jaw, that's okay, but you don't want your overall pain to be worse with this. We're trying to mobilize the jaw and improve movement, not aggravate any issues going on. Number 3 is a tongue click. Start with your tongue placed on the roof of your mouth. Open your mouth slightly and then let your tongue come off the roof of your mouth. Looks like this. Start with 5 to 10 repetitions and build up as you feel more and more comfortable. This is a pretty easy one. I think for most people it feels good to do this one, and you can build up to 20 repetitions or so. Number 4 is isometric jaw opening. The term isometric means that you're applying resistance with very little to no movement. Start with your fist placed just underneath your chin, and then gently press into your fist without letting your mouth open much, like this. So you don't really see much going on with this, but I'm pressing with medium resistance against my fist. Hold for about 5 seconds and repeat 5 times. Number 5 is isometric deviation. This is similar to the previous exercise, but the resistance is off to the side. I'll place my hand on the right side of my jaw, and gently using the muscles in my jaw, I'm going to press against my hand and hold for 5 seconds. Do it 5 times. So I'll press out to the right and relax. Now repeat on the left side. Press to the left and relax. Now I should have mentioned this before. With the isometric exercises, you want to start with your mouth slightly open, maybe about an inch or so. The purpose of that is so that your teeth and your jaw aren't clenched tight. You want a little bit of space there before you start these. The last exercise is an upper trapezius stretch. This one is focused on the entire side of your neck, which will help stretch out the muscles in your jaw, as well as this large upper trapezius muscle that often is involved with TMJ dysfunction. Bring your chin back just a little bit, and then lower one ear toward your shoulder, just like that. Hold for about 10 seconds, and then come up to the top. And repeat on the other side. Exhale as you tip over. Inhale as you come up. That breathing pattern isn't necessary, but this is a good time to remind you to be sure that you're breathing throughout the entire time you're doing these exercises. Make sure you're not holding your breath. If that feels good, but you want a little bit more of a stretch, here are a couple modifications. You can place one hand behind your back or underneath the leg that you're sitting on. Reach one hand up over your head, and as you tilt your head to the side, gently press just above your ear to accentuate that stretch. Make sure you're not pressing down on your head, but rather lifting and pressing to the side. And then come back up to the top. Repeat on the other side. Place your hand just above your ear and gently pull over to the side. And come back up. All right, moving on to the self-massage techniques. We're going to be working on massaging the pterygoid muscles. It's a group of muscles that live right here in the cheek. It connects the back of your jaw to the cheekbone and down to the mandible, your jawbone. Starting on the outside of your jaw, you'll massage in a circular motion. Circle one way, and then circle the other way. Again, let your mouth be slightly open with this, maybe an inch or so. Start massaging with mild to medium pressure for about 10 seconds. If this feels good, you can gradually increase the pressure and increase the duration to about a minute or so. Be careful not to overdo it with this one. It's fairly easy to aggravate these muscles and end up causing a little bit more discomfort in there. So this should feel like a good discomfort, but don't work it too hard. Part 2 is massaging these muscles from the inside of your cheek. So wash your hands first. I've already done that. I'm good to go. You'll want to use your thumb to massage the inside right along your cheek behind your teeth. So I will show you that, and I'm going to exaggerate it so that you can see exactly where my thumb is. So I'll use my right thumb to massage the left side. So I'll open my mouth a couple of inches, a comfortable amount of opening, and slide my thumb right in behind my teeth. Now, those muscles run up and down kind of at an angle. So you'll want to massage front to back with this one. You could try a circle, but the best movement is going to be front to back, like this. I recommend massaging both sides even if all of your pain is on one side, because oftentimes pain is due to an imbalance between the two sides. One side might be tight while the other side is overstretched. So it's helpful to massage both sides in order to allow those muscles to reset, to go back to their baseline tension, their normal amount of tension. I hope these exercises and the self-massage are helpful for you to decrease pain and improve mobility in your jaw. If your symptoms continue or worsen, definitely see your dentist or your primary care provider right away. As I mentioned in the beginning of this video, there are many things that can be related to jaw pain that need medical attention. If you have any questions about these exercises or would like to share with me how you're doing with them, please leave a comment down below. Also, feel free to share this video with anyone else you know with jaw pain or dysfunction who you think might benefit. Finally, please consider subscribing if you haven't already, and click the bell next to the subscribe button if you'd like to be notified when I release my next video. And it's always great to see a thumbs up. Here's to your healing, health, and happiness. Have a wonderful day.